All right, welcome back, everybody. So you asked, and this morning we've got answers for you. Dr. I and Dr. J are back to give you some insight on all those burning health questions you've been wondering about. When it comes to dental health this week, that's the theme. Today's segment is brought to you by Aspen Dental. Good morning, guys.
Good morning.
I don't think we've talked teeth before. This is new territory.
It's okay
for us.
Oral health is health in general.
Exactly.
So
I've had 2 dentist appointments lately, so this has been top of mind for me. Let's get straight to our true and false game. Coffee is the drink that stains your teeth most and causes headaches. Is the drink? I'm going to say true.
That's false, and thankfully
Really?
it's false because I love my coffee. Yeah. I would have
Okay,
stained
good, because
teeth
I have it every
and
day.
chronic headaches. Yeah. So no, it's actually red wine. So they did the study where they looked
Oh,
at
Lord,
coffee.
that's also bad.
It is, unfortunately. Right. A lot of people just started to cry in their coffee, right? But they did a study where they looked at coffee, soda, and red wine, and they wanted to see which one stained teeth most. And it was red wine. It went through all 3 layers. It went through the enamel, the dentin, and down to the root, which is where you have your neurovasculature, your nerves and your blood vessels. So it stains the teeth the most deeply, and because it goes to the nerves, it sends signals to the brain that cause a release of serotonin that causes blood vessels in the brain to dilate and causes chronic headaches. So yeah, wine can stain your teeth. And have you running
Don't tell
around
me
with
that on a
major
Friday.
headache. Red wine. Red wine
What
can do it.
gives?
Go with white wine. This is red wine that they looked at in the study because it has these things called tannins. So just go with the white wine.
No, what are we supposed to? I know you're not dentists, but do we brush our teeth immediately?
That's
after
actually a great question. So
wine?
in the study, what they found was instead of brushing right away, swish and swallow, wait 30 minutes, and then brush because the acidity will cause you to actually break down the enamel more if you brush right away. So 30 minutes and then brush.
Okay, makes my teeth hurt just thinking about it. Brushing your teeth more than twice a day during pregnancy can increase your risk for preterm labor. I'd say false on that.
That is false. So it's
Okay.
actually the opposite. So dental health is really part of your entire body's health, right? And so what happens is when you're pregnant, you have more blood flow everywhere, including to your mouth and to your gums. And if you have poor oral hygiene, you have this chronic inflammation. It's like a chronic infection, basically. And so your body's like, we've got to fight this infection. And so it makes something called prostaglandins. And prostaglandins are actually very...
Prostaglandins?
Prostaglandins.
You learn
And
something new
you
every
learn
day.
Every
Yes.
day.
Okay.
And prostaglandins actually are something we give to patients when we're trying to induce labor. So if you have a lot of infection, a lot of inflammation, a lot of prostaglandins, you have a higher risk of preterm labor and miscarriage. So brushing your teeth, good oral hygiene is important always, but especially during
When you're
pregnancy.
pregnant. Okay. Flossing at least once a week can reduce your risk of having a heart attack. True.
I was going to say, we just gave you the answer to the question. Yep. Oral health is overall health. And so same thing, when you don't floss
So many people are myself included, I started using a water pick.
Me too. I love my water
It's
pick.
easier.
Well,
So
I'm
much
going to
better.
tell you the trick. Floss and then water pick. That's what I do. But I'm an overachiever. But no, this is the thing. So, but when you floss every day, basically it decreases the risk of gingivitis, less inflammation, less systemic inflammation, less damage to the blood vessels in the heart, more blood flow to the heart, lower risk of heart attack. And they actually did a study that found that 40% of people who had a heart attack also had gingivitis and oral health issues.
Are y'all one of those when you go to the dentist and they're like, have you been flossing? And you lie to them?
Well, this is the thing. I will always do the water pick and floss before I go. Always.
Yes, and it's the first time you've done it in
like a month,
3
exactly.
weeks. Yeah. I am guilty as charged. True or false? Seniors should see the dentist at least once every. At least once every 2 years. True.
That's true, but really they should be going every 6 months, so twice
Right.
a year, and not just seniors, really everybody, because again, we're on the same topic. But when you have poor oral hygiene, you have this chronic inflammation, so you have a higher risk of heart attack, higher risk of stroke, but also higher risk of dementia. And what they found was that in seniors that have lost one tooth, presumably to poor oral hygiene and not fighting or something like that, they have a higher risk of dementia by 50%. Well, cognitive decline by 50%, 20% for dementia. So losing teeth, poor oral hygiene increases heart attack, stroke, cancer risk, and risk of dementia.
Wow, those are staggering numbers
That's
and
hot,
stats. Yeah. And lastly, teeth whitening strips can accelerate tooth decay. False.
It's actually true. They
true?
actually do, yes. So tooth whitening strips have hydrogen peroxide. Hydrogen peroxide kills the good bacteria in your mouth. So you have good bacteria that fight bad bacteria that cause oral health issues. You kill the good bacteria, more decay.
Yeah.
And additionally,
Oh, no.
Well, but also you get through the enamel, you get down to the dentin, and that is going to also increase more of the bad bacteria. And it's going to make the teeth a little weaker. And I've got to say, when I used the whitening strips, my teeth were super sensitive, but also that you actually kind of start to get a little translucency to the teeth, because you're breaking down those barriers.
Yes.
So
what for people who want whiter teeth, do you suggest instead they go and actually get it professionally whitened?
but a lot of
once
times
every...
the professional whitening also
That-
uses hydrogen
Same thing.
peroxide
They
and
same
the
thing.
lights. So what I normally tell people is baking soda peroxide. It's
Yeah,
actually an
baking soda
amazing
peroxide.
whitening agent, and it doesn't compromise the integrity of the teeth at all.
And brush with it?
Yeah,
Swish
brush
with
with
it?
it. Yeah,
okay.
exactly. Yeah.
Okay. I did the professional whitening whitening once in high school and have vowed never to do it again.
Yeah.
It brought me
Painful?
to my knees.
Oh,
yeah,
yeah,
it's painful.
Yeah, I know,
Increased sensitivity for sure.
Okay, fascinating. Good to know, guys. Thank you.
welcome.
It's good to see. Are you back next week?
I'm back
Or
next week.
Who's in
This guy's
St. Croix?
traveling.
I'm going to
You're-
Mauritius, actually, so yeah.
Of course you are.
be there.
Of course you are.
Somebody's gotta stay.
Okay. All right, always good to see you. Thank you. To have your medical or health questions answered on our show, find Dr. I and Dr. J on social media at the Twin Doctors _.